Hi, 2HEARTS. I'm Dr. Sarah Kelly. I'm the psychologist with the Heart Institute at Children's Hospital, Colorado. Thanks for having me today. We're talking about mental health and coping, and those are subjects that are really near and dear to my heart, and I think it's really important. I want to lead with first saying that you guys are my heroes. You're doing a great job. I'm really proud of you. It's a really difficult time to be growing up right now in the middle of this pandemic. Anxiety and depression are actually on the rise across the country and across age groups, but in particular for teenagers and young adults. You're dealing with a lot right now. There's a lot of isolation, a lot of disruptions to your normal routines, altered school schedules, and worry about your heart maybe or your health, worry about infection. And so I just encourage you right now to take a minute and check in with yourself. How are you doing? How do you feel like your mental health is doing right now if we were going to do a mental health checkup? And then I encourage you to continue checking in with yourself. Think about how you're doing, things that you're doing well, things that you're struggling with, and who you can talk to about those things and who you can ask for help. I want to lead today with the power of your thoughts. So we know that the thoughts that we have are very automatic. They happen really quickly, and we don't challenge them very often. However, our positive thinking patterns tend to lead to positive feelings, and our negative thinking patterns tend to lead to negative feelings. So similar to the power of music, if we were to listen to a really sad song, that might bring us down. As opposed to, if we were feeling sad or tired, but we listen to a happier, exciting song, we're going to feel in much higher spirits. And so our thoughts are very powerful, and our thoughts influence our feelings and our actions. And so our thinking and our feeling and our doing are all very intertwined, but we do have the power to change our thoughts and to restructure and reframe our thinking patterns. So I want to talk to you about a couple common thinking errors and thinking mistakes that we all tend to make. Our brains work very quickly and very efficiently. So about 90% of the time, we know the fastest way to do something. However, because we often take shortcuts in our brain, sometimes we are prone to these thinking mistakes. So the first one is all or nothing thinking. So black and white thinking, which is thinking in the absolutes. So this is, he never calls me back, that word never. Or she always forgets to bring A, B, or C. And saying always or never is really a red flag that you might be thinking in black and white thinking terms, when the majority of our life really falls into that gray area. And so you might start to identify when you might be doing some black and white thinking. Another thinking mistake is called disqualifying the positive. So this means that you could have 99 pieces of positive information and positive feedback, but you get one negative thing and you pay attention to that. So you might see this, for example, on social media. If a ton of people like something, but then one person makes a negative comment, and then all you find yourself thinking about is that negative comment. Or for example, when you turn in a paper assignment for school and your teacher gives you lots of positive feedback and things that you did well, but provides one piece of constructive feedback, and you find yourself just really feeling down about how you didn't do well on that one thing. So that's disqualifying the positive. The next thinking mistake is called catastrophizing. This is just thinking that the world is going to end, that the worst possible thing is going to happen. So this is only seeing situations while expecting the worst case scenario to happen. And so we often do this without asking ourselves, is that really, what are the odds that that would really happen? Or what's the most likely situation? What's the most likely outcome? The next thinking mistake is called jumping to conclusions. So this is interpreting something without all of the evidence, without all of the information. You can be prone to doing jumping to conclusions when you're also trying to mind read, when you're trying to understand what someone else might be thinking without actually asking them, or fortune telling, which is when we try to predict the future, when we actually don't know what the future is going to bring, and we tend to predict that something bad is going to happen. And so when you have these negative thinking patterns come up and you start to notice them, I want you to say time out. Okay, I want you to time out, think about that thought that you're having, label it, and also ask yourself a few questions. First, say, is this accurate? What is the evidence for this thought? The other question that you can ask is this thought helpful or unhelpful? Right? So some thoughts are not helpful. And so it's helpful to change those back into something that is a little bit more positive. And in terms of healthy thinking strategies that you can start to get into the habit of, first is positive self-talk. That is the process of changing those negative thoughts into positive thoughts. And the more you do this, the easier it gets and the more automatic it becomes. Our brains are naturally prone to pretty negative thinking because we are looking for threats in our environment, and that is really self-protective, but we also have to combat that with some positive thinking so that it doesn't become overly negative. Also, determine what is in your control and what is not in your control, okay? So ask yourself, okay, is this situation something worth worrying about? I like to say worrying is like a rocking chair. It gives you something to do, but doesn't get you very far. So what are you going to do with that worry? If it is something that is in your control, then do something. You can do something, and you just have to ask yourself, what's the first step that I'm going to take action? So this is problem solving. This is asking for help. This is taking some positive action in order to address the problem. Now, if the situation is not in your control, you can't really act in that same kind of way. So the first step is to accept that this is a problem that is out of your control. That doesn't mean that you have to say that it's okay or that you're condoning it in any way, but it's just accepting it, good or bad, that it is what it is. Then redirect your thinking to focus on what you can control and focus on what you can do in the setting of those limitations of the things that are outside of your control. Lastly, it's just important to have healthy routines every day and little rituals that you can do to promote healthy thinking and healthy coping. And one of these that is helpful for everyone to be doing on a daily basis, 5-10 minutes a day, is relaxation. One of my favorite strategies for relaxation is to sit down in a cool, dark room, dim the lights, maybe light a candle or use essential oils, and find some time to just kind of like disconnect from your devices, relax, and spend some time slowing down your breath, deep breathing, inhaling through your nose, holding it in your belly for a couple seconds, and exhaling, and finding a rhythm to your breath, going in and out in a rhythm. And that allows your body to calm down and physically relax. Those effects of stress really do affect us in our bodies as well. And so this is a chance to tell your body that, okay, now is the time that you can relax and that you don't have to be on guard or on edge. And then take a mini vacation. And what I mean by this is that we can't really do a lot of traveling or getting out right now. But all you have to do is close your eyes, and your mind will take you to wherever you want to go. So choose some place, preferably someplace that you've been that is just really relaxing. Outdoors scenes work really well, so like the beach or a mountain scene with a creek, someplace that you can just imagine yourself feeling so relaxed, no to-do list, nothing to worry about, no one to talk to that you have to stress about, just a chance to kind of feel like you have a chance to recharge and reconnect with yourself. And so just use as much imagination as possible and as many senses as you can to really close your eyes and imagine in as much detail to describe what you're seeing, who's there, what's there, what are you doing, what do you see, and what do you hear, what are the sights and sounds, what do you smell, taste, touch, and really think through and spend a lot of time imagining that situation. After 5 or 10 minutes or so, when you decide that it's time to kind of come back home and end your vacation, you'll feel like as if you really were on a vacation, and your body, even though it was physically located in your home, it had a chance to feel as if it was on vacation. So that's one of my favorite strategies I wanted to share with you today. So I hope that gives you some talking points to think through. What are some of the thinking mistakes and thinking traps that you might be getting yourself into? And what are some other healthy thinking strategies that you can start to do on a daily basis to help promote your mental health? Thanks for having me.